Angina is a condition in which there is incomplete blockage of coronary artery that is approximately 90%, which results in decreased blood supply to myocardial muscles, which leads to severe chest pain. Main causes of angina and decreased blood supply to heart can be due to hardening of artery, stress and trauma. When coronary arteries get hard mainly due to aging process, blood supply to myocardial muscles decrease. Secondly, stress can lead to increased heart rate. Heart has to work more, due to which myocardial oxygen demand increases. If heart is not able to meet that demand, can lead to angina. Next, trauma to heart can also cause angina. Next are types of angina. First is stable angina, or also called exertional angina. It is predictable as it is triggered by physical or mental exhaustion. Chest pain occurs for less than 15 minutes and relieves by rest of nitroglycerin. Second type is unstable angina, also called pre-infarction angina and crescendo-decrescendo angina. It is unpredictable as pain can occur at any time. Pain is for more than 15 minutes and not relieved by rest or nitroglycerin. Patient will need opioids or antiplatelets to decrease this pain. Third is vasospastic angina, also called variant angina or pringe-mental angina. It occurs spontaneously, commonly at night and early morning. It is more common in women and smokers. Occurs mainly due to coronary artery spasm. So, for dilation of coronary artery, we have to give calcium channel blockers or nitrates. In this type of angina, ECG shows ST segment elevation. Fourth is silent angina. In this angina, clinical report or ECG shows evidence of angina like ST segment depression and T wave inversion, and signs of ischemia, but symptoms or chest pain does not occur. This type of angina is common in patient with diabetes mellitus and hypertension. Fifth is postprandial angina. Chest pain occurs after 2 hours of food intake as cardiac workload increases due to increased metabolic demand. Sixth is nocturnal angina. Chest pain occurs during nighttime in supine or dorsal position but relieved by sitting position. All type of angina shows ST segment depression except vasospastic angina. In vasospastic angina, ECG shows ST segment elevation. Now let's discuss clinical manifestations. Patient will have retrosternal, squeezing chest pain. Retrosternal means behind sternum bone, which radiates from left side of thoracic region to left shoulder, than jaw, neck and left arm. Mostly, pain is for less than 15 minutes and relieved by rest, nitroglycerin and oxygen therapy except variant angina. Other symptoms include dyspnea, tachypnea, coughing, anorexia, nausea and vomiting. Next is diagnostic measures. For early diagnosis, we can do ECG. ECG will show ST segment depression, T wave inversion except vasospastic angina. Confirmatory diagnosis is angiography, in which we can visualize blockage or narrowing of coronary arteries. Cardiac markers will be normal. Preferred diagnosis for screening is treadmill test. Involves walking or running on a treadmill. This test is utilized to assess how effectively the heart responds when it is working harder than it does at rest. In lipid profile, we may find increased cholesterol level. Now management, initially provide bed rest to decrease oxygen demand of patient, then give oxygen therapy. In pharmacology management, drug of choice is nitroglycerin to reduce chest pain. If pain is not relieved by nitroglycerin, we are given antiplatelets like clopidogrel. Anti-lipidemic like atorvastatin, calcium channel blocker, nifedipine. Surgical management includes PTCA, that is percutaneous transluminal coronary angioplasty. It is minimally invasive procedure to open blocked or stenosed coronary artery, allowing unobstructed blood flow to the myocardium. Next is cabg, coronary artery bypass grafting. It is done to treat a blockage or narrowing of one or more of the coronary arteries. It uses healthy blood vessel from another part of the body and connect them to blood vessels above and below blocked artery. Diet include low sodium and low fat and high calorie food. I hope this video was helpful. Thank you.